patient has a wound, okay? So of course we have to put sutures in. So the first thing that we need to do is we need to clean, right? We're going to clean my patient's wound. All right, of course, if there was any dirt or debris or anything, we would clean it with saline water. You have to take out your sutures, all right? Open the package, you're gonna take it out, there, and you gotta please be careful, all right? Please be careful. Go back in again.
这一次我真的睡着了。
And you make another knot. Okay? Okay. Now your patient, right? Of course he would be, this part would be all sedated and everything. You know, he wouldn't feel it. And you're going to do it with what we call, or the doctor would be doing it, with what we call a fenerated, okay, drape, which means that your patient would be covered and there would just be a hole there. Oh. Okay, so fenerated actually means that there's the hole, all right? We do this, okay. Yes, it's wonderful. So much. I'm gonna open up another one of these so everybody can have. Some of them are straight and some of them, these are what we call hemostats. Hemostats, okay, because you see how it has the things here? Mm-hmm. All right, so that means if I needed to, let's say if I was doing surgery and I needed to like, not cut a vein, but block a vein for the moment, all right, so something in the artery so it stops bleeding, I would put this here. Why? Because once I do this, right? Let's see if I was to do this. I gave my patient 1, 2, 3, 4, 5. I'm going to give my patient one more suture because I want it to be even. All right, an even number. And I'm going to tell you why. All right, this goes in here because this is sharp. That's why I gave you. How many days might be staying in?
Oh,
7
is
to
it?
10.
7,
All right?
okay.
7 to 10, okay? You would be responsible for giving the patient instructions. Don't get them wet, all right? Keep it covered for about 24 hours or so. After that, you have to let it get some air. 7 to 10 days, right? Normally it would be like so. My patient's coming back, right, to have it taken out. Okay. We want to start with every other suture. We do not want to go, okay, to the end. So we're gonna do this one, all right? Well, we can do this one, we can do this one, and then we'll do this one, all right? But first we wanna start with every other suture because we wanna make sure that the incision is healed. Okay, you would take your suture removal kit. This is where you're going, right? As close to, see here's my knot, right? I'm pulling it up. You got that? See? I'm going here as close to underneath right there as I can get. All right, cutting it and I'm pulling it this way. Okay, why? I'm making sure that the suture material that is on the top, that was on the outside, all right? So I would never do this. Let me see if I can grab one down here that I didn't make so tight, right? I would never cut like here. I kind of made these nice and tight. All right. I would never cut like right here before the knot, all right? And then pull it this way, all right? Because what I just did was all the suture material that was on the outside, I just pulled it through, okay, the incision, which means any bacteria that was there, I took that bacteria with it, okay, to inside of that patient. I am not going to do that, all right? So far it looks good. I'm going to go here, pull it up from the knot, go as far, as close to the skin as I possibly can on this side of the knot, right? Yes? Yes? And pull this way. All right? So this way I am pulling, okay, it away. All right? So anything, because we've cleaned our patient, so I'm getting as close as I possibly can here, okay, so that when I pull, very little of the suture material that was on the outside. If not, my suture, my thing looks good. All right, I'm doing this. Now that my suture, I took it off, my incision looks good. Okay, I'm gonna send my patient out with some steri strips, all right, just to ensure that the incision stays closed, okay, and tell them to go ahead, take a shower, get it wet, do whatever, and leave the steri strips on until they fall off. Yeah, they look like little strips. There we go. Pull it through, and of course, guys, make sure, right, that you count. We had 6 going in. 1, 2, 3, 4, 5, 6.